Hello, Gold participants and listeners from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And here at Gold, our preparations for the upcoming Gold Midwifery Online Conference of 2020 are in full swing. And what we like to do here at Gold is meet with our speakers so you, our listeners, are able to get to know them a little bit and find out what they're working on now and find out a little bit about the presentation as well. And with me today is Crystal Karges. Welcome, Crystal.
Thank you so much. I'm so happy to be here.
Oh, it is wonderful to have you here, and you will be part of our perinatal nutrition lecture pack, right?
That's right. And I'm so thrilled that this is something that's being covered in this conference. It's really an important part of prenatal and postpartum care.
Absolutely wonderful. And we'll jump into that in just a minute. But before we go into the topic, and I know this is a passion of yours and you can probably talk for a long time on that. But before we do so, I would like you to introduce yourself to our listeners and tell them a little bit about yourself. I know you're a master dietitian, you're an IBCLC and a food and body image coach, and you have 5 little ones. So, Crystal, how you do it all?
Oh, I certainly don't. And I have a lot of help, which I'm very thankful for. But yes, as you mentioned, I am a registered dietitian nutritionist and also board certified lactation consultant with a specialty focus in maternal health. And yeah, I would say so much of my career was definitely driven by my own experiences in motherhood and having and birthing and raising 5 children, which I have and range from the ages of 9 years old to 2 years old. And just from my own experiences, I personally struggled with and recovered from postpartum depression, and just my experience and journey through that really realized how big of a piece of the puzzle is postpartum nutrition in regards to improving and optimizing maternal mental health. And so that's been a real special interest of mine and something that I am doing a lot of research in, but also it's something that I'm very passionate in my own private practice in supporting mothers who are going through this journey and just really helping to educate them and guide them through a time in their life that can be so full of joy, but also very overwhelming. And yes, this is just one piece of the puzzle, but an important piece that I'm just thrilled to be here and chatting with all of you about today.
Absolutely fascinating. Yes, and you brought up something that not too long ago nobody was really talking about nutrition and the connection the to postpartum depression, and that is absolutely fascinating. So when you got into the topic, what have you seen? Is there a lot of new research out? How has that changed over the years that you have been researching the topic?
Yeah, and I definitely think there is definitely a lot of new research out that's showing us how, even specific nutrients and deficiencies in these nutrients can increase risk of maternal mental health illnesses, both in pregnancy and postpartum. And when we talk about something like postpartum depression, of course, it's a very complex matter. And, I don't want to create the idea that just eating better will somehow cure us of that because, there's so many different factors that are involved. But
Right.
what
Mhm.
excites me is that if it's one area that we can look at, it really can be a preventative measure for helping decrease the risk of maternal mental health conditions like postpartum depression. And I think that's where I get excited because we really can empower the women that we're working with by helping them look at the areas in their life that they do have some control over, like what
Right.
they're putting in their bodies and how they're feeding themselves. And it's something that really gets pushed to the back burner when we're talking about bringing a new human being into the world and things feel overwhelming. I think it's so easy for moms to push food and nutrition aside because there's so many other things that take precedent. And so I think the message that I want us to know as providers is that we can really come alongside women and encourage them, support them, and empower them in making decisions for how they're caring for their body with how they eat, and all of those different things. So, yeah, that's something that I'm really excited about sharing more about today.
Oh, that's wonderful. You brought up a very good point there that, that nutrition is, pushed aside a little postpartum because mom is very busy with a new baby. And I have a feeling we're doing a better job nowadays to counsel on nutrition during pregnancy, right?
Mm,
And then postpartum rolls around, and mom, it can be very overwhelming time, with a little one. All of a sudden,
mhm.
it's a completely new life, and the baby, takes priority, and then often, or not often, but in some cases, mom is neglecting her own nutrition because she's so busy caring with the baby. She says, I have no time to take even a shower. I can't cook a meal. I don't have time to sit down and eat because I'm nursing, I'm caring for the baby, right? Do you see that often too?
Oh, absolutely. I think that's one of the most common issues that I see. And you're right. I think there is so much focus on nutrition during pregnancy because, baby's growing in mom's
Yeah,
body and, she's more proactive about taking care of herself for the
right,
most part.
right,
But it's like as soon as baby comes out and is in the world, I think there's somewhat of a disconnect with, mom feeling like her body is not as important in taking care of it in the
right.
same intensity and focus. But what I am trying to get the message out and help moms see is that postpartum is even more important to take care of your nutrition because I call it the snowball effect. There's just a compounding nutrient deficit happening that starts from pregnancy and then is furthered by childbirth and then lactation and breastfeeding. And so, all these things can really snowball and create put mom in a hard position where she's not taking care of her nutrition, and now we have a risk factor for things like postnatal depletion, postpartum depression. And
Yeah.
so we really want to make sure that we're spending time focusing on this area. And what I like to help
Uh-huh.
moms understand is that it's not about perfection. I think sometimes
Right.
it feels like one more thing on her plate that she has to do, and
Yeah.
you know, I don't I don't want moms feeling that way when they're in postpartum and caring for a new baby, but more just how can we help you? How can we support you in caring for your body? And I always tell moms that eating is the most valid form of self-care. I think self-care is
Oh,
a really trendy term right now.
yeah.
And it
Yeah, you're
gets
right.
lost in translation of what that means, but really it's about the basics, like caring for your body, feeding yourself so that you can be empowered in this early phase of motherhood to be the mom that you want to be and to really thrive. And so yeah,
Oh, that's a
I'm so passionate about helping moms with this.
Yeah, and I can hear your passion in your voice. It's wonderful. And that was really empowering what you said there too about self-care. And you're right. It's we throw the word self-care around, you see it on social media. Everybody is talking about it. And it's not the bubble bath only, right? I mean, that's nice.
Right.
Like, but it's and the most essential things like caring for yourself, feeding yourself, nourishing your body. And this is so important, so important. And yeah, sometimes we lose track of the uh, the most important basic
Right. And I think
issues there.
helping moms get back to those basics is something that we can do as perinatal
Yeah,
professionals, and especially in the postpartum phase, where I think during pregnancy, mom has so many touches with her provider. And then
right.
postpartum, that really changes. And I think there's kind of a vacuum where mom feels alone. And, sometimes I
Right.
think we forget that postpartum depression can develop through the year of, postpartum. It's not just like
Yes.
in the first 6 weeks. And so, really
Right.
just informing, educating, and supporting mom can make such a difference in how she cares for herself.
Absolutely. You mentioned something interesting. You're saying like, yes, many of the women you see are, better educated when it comes to nutrition, and they want to, make healthy choices and lifestyle changes. But it can also then, on the other, this flip side of this can also be that women, there's a lot of guilt and shame with that as well. So, um, I tell you a story that I recently encountered. One of my clients who had a beautiful home birth and a baby latched on afterwards, a good nurser. And one day, the baby was maybe like 2 weeks old. She calls me and she says, I'm so worried. The baby is, nursing great and everything is just good, but he's not putting on weight. He was on the lower end of the, weight scale there at the curve at the pediatrician. And the first thing she came up with and says, "Oh my God, I must not be eating right, or I'm starving my baby. Something I must be doing something wrong. I must not be giving him the right nutrition through my milk, and my diet must be off." And she felt horrible, and she's saying, "I'm shrink. My baby is not growing, and it's my fault."
Oh.
Um, what do you say to a mom like that?
Yeah, and I'm so glad you brought that up because this is definitely something that happens a lot, right? When mom is nursing and breastfeeding and baby is basically depending on her for growth and
Right.
nutrition, obviously. And I think there is that assumption, right? That, what I'm doing and how I'm taking care of my body is directly implicated and affecting my child. And one thing I always try to remind moms is that number one, you're more than your breast milk, that your worth and your value are not hinged on what's happening with breastfeeding. And yes, of course, like we want it to be successful. We want
Yes,
we
absolutely.
want things to go smoothly, but I think sometimes as moms we put so much pressure on ourselves and that can backfire if it creates
Yeah.
some guilt, shame. And so I really try to help remind moms with that everything is figure outable. Like we can always find solutions and help troubleshoot with the right resources and professionals. But shaming yourself or guilting yourself is not part of the solution. And I think moms need to be reminded of that. And
Yes.
and this is something that I do touch on in our presentation is
Oh,
about
great.
eating disorders or disordered eating, which I see happen a lot during pregnancy and postpartum. And it's very important to address this because it can absolutely have an implication on mom's overall nutrition and mental health. And I think it's something that goes under the rug a lot. I think it's not something we're commonly looking for as perinatal providers, but it's
Yeah.
a very important issue, and it's something I do address in this presentation as well.
Fantastic. I'm looking forward to that. It is true. That is such an important topic. And again, there's not enough research out there, or maybe now there is more than just a few years ago, but it is important for healthcare providers to learn about that. How can we approach that without, shaming and using the right words, using the right encouragement to help our clients to the best of our abilities.
Absolutely.
And oh, just want to give you a quick update on the story I was telling. The baby's absolutely fine. He just needed his own little time to grow a little faster.
Oh,
And
I'm
now
so
he's
glad to hear
happy and
that.
chunky. There's nothing. He just stretched out first to become longer,
Yes.
and then he filled out. So he's all good. But
Oh,
yeah,
good.
thank you for saying that. Yes, and yeah, I'm looking forward to the presentation very much and learn more about your tips and advice you can give us for optimizing prenatal nutrition here.
Thank you so much, Kristen. I'm so delighted to be here and just hope that this is a helpful resource.
Oh, thank you. And quickly before I let you go, I saw something on the blog, and I know we don't have that much time to speak about it, but I saw something on your blog that intrigued me, and you are speaking about intuitive eating there.
Yes.
What is meant by that? I was just looking at that going, "Ooh, this sounds, it looks intriguing." So could you tell us very briefly a little bit more about that before I let you go?
I'm so glad you asked this question, Kristen. This is something I'm also passionate about, and intuitive eating is basically a approach to eating where we are helping a person learn to become the best expert of their own body again. And what I mean by that is, in today's day and age with social media and the internet at our fingertips, there is so much misinformation out there about nutrition. And not to mention, we live in a culture, or what I like to say, a diet culture, where so much of how we feel about food and feeding our bodies and the way we feel about our bodies is influenced by diet culture, which means typically there's a lot of diets that are being pushed, and right now, like, the whole keto thing is all the rage, and I think people get confused with not being able to really listen to what their own body needs, but they're focusing on the external. They're listening to what everyone else is saying they should do when it comes to how they feed and take care of their body. So intuitive eating is really guiding a person to really reconnect with their body's innate wisdom of what they need to eat. And I always say babies are the perfect example of what intuitive eating is, because they're born with that, what I call our factory mode, what we're all born with. And if you think about a baby gives us those cues when they're hungry and when they need to eat, and they show us when they're full and when they've had enough, and they can very much self-regulate what they need in terms of nutrition. And with intuitive eating, it's really empowering a person, and in my case and in my practice, empowering mothers to reconnect with that wisdom so that they can have a peaceful relationship with food, because our health is not just about the food that we eat. Yes, that's an important piece of the puzzle, but it's also about our relationship with food. And typically individuals that are dieting or on chronic diets, food can feel really stressful and they can feel at war with their own body. And so intuitive eating is guiding them to a peaceful relationship with food and confidence in their own body by helping them learn to be the expert of their own body again.
That sounds absolutely wonderful. And you're right, all these diets are out there, and social media, as you mentioned, bring a lot of these to the awareness, and we always think, oh, we have to keep up, we have to, this is the latest, and there's right scientific evidence for this, so we have to do this, for that one, and this diet, and keto, and low fat, high fat, low carb.
Mm-hmm.
And but and you're so right, it's about the relationship with food. If we're talking about some foods as good foods and bad foods, and so there is absolutely something about it, and having a peaceful relationship with food and a peaceful relationship also to our bodies. That's something that's really wonderful if we can achieve that.
Absolutely.
Well, Crystal, thank you so much for sitting down here and chatting with me. It was wonderful, and I am looking forward to your presentation here at Gold.
Thank you so much, Kristen. It's my pleasure, and thank you again for having me.
And for our listeners, the presentation Optimizing Perinatal Nutrition to Support Birth Recovery and Maternal Mental Health is part of the Perinatal Nutrition Lecture Pack here at Gold. And that presentation will be available on February 4th. So if you want to find out more about this presentation and the other presentations in this lecture pack, you can visit goldsmidwifery.com and goldlearning.com. And I hope to see you at the presentations. Bye-bye, everyone.